Hi folks, welcome back to Coffee with Ravi. Thank you for all the encouragement that you've been giving me in person when you see me. That's what keeps this going. Today I wanted to talk about stomach ulcers. It's a very common cause of issues that seek gastroenterology care. Stomach ulcers are like breaks on the skin, but only they're inside in the lining of the stomach. They could be in the stomach or the first portion of the bowel called the duodenum. I have a photograph of how that looks like when you look at the stomach, which is a small sac-like structure that sits up here. Contrary to what we commonly think, the most common cause of stomach ulcers are an infection called Helicobacter pylori. Helicobacter pylori is an infection that we get over a period of time that sits in the stomach and in some patients causes ulcers. Other groups of medications such as ibuprofen, naproxen, Aleve, these kind of things that can irritate the stomach are another common cause of ulcers. Very rarely, causes such as cancer, lymphoma, etc. are also they come up as stomach ulcers. How do we find out or how do we know that we have ulcers? Number one, we can present with bleeding. This can be frank blood that pours out through the bottom or black stool. Sometimes it causes pain, and not all the time can you have pain. That's the strange thing. So they can be silent. So bleeding can be an issue. The diagnosis of this is by endoscopy, where we take a camera and go down the stomach. Sometimes the same camera can take biopsies, which will then diagnose the infection. The treatment for this depends on whether they're bleeding or not. If they're bleeding, with endoscopy we can patch up the ulcer. So we take the camera, get down there, and using a variety of probes we can stop the bleeding. After the bleeding, if they don't present as bleeding and they're just sitting there, if there's infection, you treat the infection with antibiotics. The other common group of medications that we use for treatment of ulcers are called proton pump inhibitors, which are medicines like pantoprazole, prilosec. The common names are the generic names are omeprazole or pantoprazole. Very rarely there can be complications of ulcers, such as scar tissue that forms and blocks the stomach from emptying. At that time, we can open the stomach openings up with a balloon through the camera. Very rarely that needs surgery. How can we prevent this? Number one, avoiding ibuprofen type medications unless we absolutely need it. The second aspect of it is that if there is black stool or bleeding or blood, seek the attention of your healthcare provider. And as always, I think continue to observe your body and be vigilant for any changes. That can be a preventative strategy too. Thank you for joining me today. Hope to see you next week.